Welcome to episode 8 of the series PEP Talks on Pain in Children. In the previous video, we've looked at addressing pain in older children, older than 18 months. But today, we're going to shift our focus to babies. Good day from me, Annemarie Oberholzer. Today, we're going to discuss pain management for babies during medical treatment and procedures. As mentioned in the previous video, the Declaration of Montreal clearly states that access to pain management is a fundamental human right, and that it also includes babies. However, it becomes a bit tricky where babies are concerned. In the first place, the different ways of assessing pain, as we've discussed in previous videos, are not as effective in babies. We cannot use self-report, as babies cannot tell us when they've got pain. Well, sure, they can cry, but it's not always clear whether they're crying because they're hungry or because they have pain. Even parent or caregiver report might not be very useful, as the parents are also new in this and often don't know their baby well enough to be able to tell whether he or she is crying because of pain or not. So, if you haven't done so already, I really want to encourage you to watch the 6th video in the series on pain assessment, especially the part on behavioral observation and physiological measures, as that is usually the only way of finding out whether a baby is experiencing pain. So let's look at some misconceptions with regards to pain in babies. Many people believe that babies won't remember it if they experience pain. However, it was concluded that boys who had a circumcision at birth actually had a more intense response when they had to have a painful immunization a few months later. Another misconception that caused a lot of unnecessary pain in babies not so long ago was that babies can't feel pain because their nervous system is underdeveloped. Now, I'm sure you all know that this is not true. Although it is true that the myelination of a baby's nerves are not complete yet, incomplete myelination of the nerves might lead to slower conduction, but definitely not to an absence of conduction of the pain impulse. So, for those of you who think that I've made it all up, why would anyone believe that babies can't feel pain? Have a look at this article that appeared in the Lancet in 1987. They did a study on babies who had to go for a PDA repair. Now, for those of you not familiar with the procedure, it's a repair of an opening between the two major blood vessels leading from the heart, and it's done by making an incision between the ribs. Obviously, a very painful operation. But only half of these babies received an anesthesia, fentanyl. The other half only received nitrous oxide, or laughing gas, and this is just causing euphoria, feeling happy and relaxation, but it does not put you to sleep. They also received a muscle relaxant, so the babies can't move around during the operation. Remember, these people really believe that the anesthesia could be harmful to the babies and that they can't feel pain, so they thought they were doing the right thing. So the findings indicate that preterm babies had a substantial stress response to surgery. Now, obviously, that's all those who didn't receive a proper anesthesia. And by giving them fentanyl, a proper anesthesia, can prevent this response, and the babies also recovered much faster after the operation. We can just be glad that there were studies like this that could put an end to the unnecessary pain experienced by babies. Something else to take into account is that the neural circuits that discriminate between touch and nociception, that's pain, only emerge between 35 and 37 weeks gestation in the human brain. Wait, what? That means that babies born before 35 weeks have a disorganized circuitry and they cannot distinguish between nociceptive messages, pain, and tactile messages, touch. Now, taking into account that neonates in neonatal ICU experience an average of between 7 117 daily procedures that we would regard as painful. Preterm neonates could also experience things like nappy changes and even being touched by a loving mother as painful. In addition to that, the nociceptor receptor field in a neonate is larger than that in an older baby, and it overlaps. So any single stimulus is just so much more likely to excite a greater number of nociceptors, leading to an increase in the pain experience of a neonate. Now, if we take into account that early neonatal exposure to unmanaged pain can be linked to numerous negative long-term effects, such as being hypersensitive to pain, in future, the older child, detrimental psychological outcomes, and changes in neurodevelopment, it holds significant implications for pain management in the older child, as discussed in the previous episode. Now, this article is quoted in the previous slide and is also great information on the management of pain in neonates. So let's look at some of the strategies that's been proven effective in the management of pain in neonates and babies. As mentioned, preterm neonates can't distinguish between pain and touch, so it's important not to use soft strokes on a preterm neonate, but rather apply positive, gentle pressure, such as facilitated tucking, also called still touch or containment holding. Now, as you can see in this picture taken from the article cited here, and so by the way, you'll find all references in a slide at the end of this episode. They've used a stuffed hand to hold the baby in a comforting position with flexed arms and legs, just as it would lie in the womb. Remember, when we say no soft strokes on a baby, we're only talking about preterm neonates, not full-term babies. Infant massage can be a great tool to reduce and prevent pain in babies. The Johnson & Johnson website has a long list of benefits of infant massage, such as that it's soothing to a baby and reduce crying. Aid digestion, help relieve colic, pain, gas, and constipation. It leads to better sleep, relieve teething discomfort, improve muscle tone, and helps the baby to relax. And that's just a few of the many advantages that they've got on the website. Swaddling or wrapping a baby in a blanket have been used for ages to help babies feel secure and to comfort them. But remember to wrap the baby in such a way that his or her hands are close to the face, as that helps the baby to self-soothe. Skin-to-skin contact, also called kangaroo care, has also been used with great success to soothe infants and combat pain, and has also been linked to weight gain. As mentioned in the previous episode, the position paper from the World Health Organization on reducing pain during vaccinations gave a number of measures on how to reduce pain in infants, but unfortunately, we don't always see these measures in practice, even though this was already published in 2015. For babies, the presence of parents or caregivers are just as important as in the older child, and they also recommend that babies should be breastfed during the procedure. Non-nutritive sucking, that's sucking on a dummy or pacifier, the use of sucrose, as well as breastfeeding, has all shown to be effective in reducing pain when in babies under 6 months or 1 year of age when they have experienced painful procedures. Now, I really want to encourage you to look at this video on YouTube. Reduce your infant's pain during newborn blood test. It's been published by the B Sweet Babies campaign. It discusses what I've mentioned here and also show you exactly how it should be done in practice. You can also see the reaction of the babies throughout the procedure to convince you that this is really effective in using these procedures. You will also find a link to this video as well as many others on the information page of the PEP program website under the topic pain. There are often different concerns for various reasons amongst healthcare professionals that prevent them from implementing the strategies discussed in this episode. A recent article on a hospital-wide initiative To eliminate or reduce needle pain in children also included the strategies I've mentioned today. And one of the main outcomes of this study was that the concerns of the staff were dispelled when they could experience the many advantages of these strategies. So I really want to challenge you today to start a nationwide initiative in South Africa to eliminate or reduce needle pain in infants and children through the strategies discussed today and in the previous episode. So let's speak up. Let's be the voice of those without a voice, so that no baby or child will have to experience any unnecessary pain. This episode concludes the series on pain in children. Thank you for joining us.